Telehealth, using technology to bridge the gap. How many times have you heard it said that the internet has transformed modern life? Indeed, it's probably changed how you stay in touch with family and friends and search for information about health problems. But are you using the array of telehealth tools available to improve your health and wellness? If not, you may be falling behind the times. So, what is telehealth? According to the World Health Organization, telehealth is defined as the delivery of healthcare services where distance is a critical factor by all healthcare professionals using information and communication technologies for the exchange of valid information for diagnosis, treatment and prevention of disease and injury, research and evaluation, and for the continuing education of healthcare providers, all in the interest of advancing the health of individuals and their communities. The history of telehealth, how it all got started. Telehealth was originally referred to as telemedicine. Telemedicine is often used interchangeably with telehealth. However, telemedicine is usually referred to as services that can only be provided by doctors. Telehealth began initially with telephone consultations. Telehealth was coined in 1970s healing at a distance, but can be traced to the mid to late 19th century. It was designed to improve patient outcomes by increasing access to healthcare and health information and to overcome temporal, social, and geographical barriers to healthcare. The first published account of telemedicine was in the early 20th century, where an EKG was transmitted over a telephone line. The ANA in 1996 decided the term telehealth was a more inclusive and accurate description of the services rendered than the term telemedicine. Examples of early milestones. Use of television for consultations between general practitioners and specialists at a state mental hospital. Delivery of expert medical advice from a teaching hospital to an airport medical center. The most recent drivers of the past decade have been the rapid developments in information and communication technologies. Changes from analog systems to digital systems have decreased the overall cost associated with telehealth, which has piqued interest around the world. The internet has propelled the use of telehealth forward. Components of telehealth and its applications. Telehealth includes a growing variety of applications and services such as two-way video, email, smartphones, computers and the use of internet, interactive video transmission, teleconferences by telephone or video, and direct links to healthcare instruments and wireless transmission of imaging services. Common applications include teleradiology, in which test results are forwarded to another facility for diagnosis, continuing professional education, including presentations by specialists to general practitioners, and home monitoring, a supplement to home visits from nursing professionals. Telehealth can be divided into two general types of applications: real-time communication and store and forward. Real-time communication may be a patient and a nurse practitioner consulting with a specialist via a live audio or video link, or a physician and a patient in an exam room communicating through an interpreter who is connected by phone or webcam. Store and forward refers to the transmission of digital images as in radiology or dermatology for a diagnosis. Pros of telehealth. Improved access. Telehealth has been used to bring healthcare services to patients in distant locations. Not only does telehealth improve access to patients, but it also allows physicians and health facilities to expand their reach beyond their own offices. Given the provider shortages throughout the world in both rural and urban areas, telemedicine has a unique capacity to increase services to millions of new patients. Cost-effective. Telehealth has been shown to reduce the cost of healthcare and increase efficiency through better management of chronic diseases, collaboration among healthcare professionals, reduced travel times and costs, and fewer or shorter hospital stays. A physician can monitor a patient's condition in real time without having the patient come into the office. Improved quality. Studies have consistently shown that the quality of healthcare services delivered via telehealth are as good as those given in traditional in-person consultations. Having access to care and specialists has improved the quality of healthcare to patients living in economically disadvantaged areas. The patient can take an active part in his or her own healthcare. Consumer demand. Studies have shown in documented patient satisfaction surveys support for telehealth services. Telehealth impacts the patient and their families. The patient is able to stay in their communities, use their local hospitals, and their local healthcare providers. There is no need to travel long distances for healthcare. This brings convenience to the patient and less time in the waiting room. Cons of telehealth. Liability. There are still ongoing issues with providing telehealth across state lines. This also brings concerns about HIPAA regulations and state privacy laws. Reimbursement. Unless the patient is seen in person, many third-party payers do not provide reimbursement. This continues to be a barrier for telehealth promotion. Healthcare professional resistance. There is still ongoing resistance to change by the physician or healthcare worker. Some resistance is due to being uncomfortable using new technology or not being able to personally touch or feel the patient. There is still much needed education on the benefits of telehealth. Cost. Although cost for telehealth is decreasing, some physicians or clinics are not able to expense the cost of equipment, network services, and the staff needed to train and provide training. Telehealth has the potential to make a difference in the healthcare of not only Americans but throughout the world. Its achievement will depend on resolving some of the cons and making them pros. With technology advancing the way it is right now, one has to agree that telehealth is here to stay. Conclusion. Telehealth adds a new paradigm in healthcare, where the patient is monitored between physician office visits. This has been shown to reduce hospitalizations and visits to the emergency room significantly while improving the patient's quality of life. Telehealth also benefits patients where traditional delivery of health services is affected by distance and lack of local specialists or clinicians to deliver services. There are a range of benefits of telehealth, which directly apply to individual patients, family members, and healthcare providers, as well as to community organizations, healthcare facilities, and governments. Direct and indirect benefits of telehealth include improving the way patients and their families access information, improving health outcomes for patients, empowering consumers and communities by providing accessible health education and decision-making options, improving the way healthcare providers deliver care and access information, enhancing recruitment and retention of healthcare providers in rural, remote areas, lowering healthcare costs, reducing travel, minimizing time off of work, decreasing patient wait time, decreasing patient anxiety, eliminating unnecessary repeat diagnostic procedures or tests, improving early diagnostic capabilities, improving administrative and communication capabilities, improving emergency triage. Telehealth shows great potential for advancing preventative medicine and the treatment of chronic conditions. Telehealth was built with the premise in mind that telecommunications technology is a tool that can drastically improve the distribution of medical care services. The utilization of telehealth systems in the United States will undoubtedly continue to rise upward. Not only do telehealth services increase patient satisfaction, but they also produce far greater quality outcomes and a reduction in on-site visits, unplanned hospitalizations, and emergency room visits.